I hope everyone can hear me okay. Great, thank you. It is such a pleasure to spend my morning with all of you. I want to first thank you for taking time to be here and prioritizing your health. So first, I just want to offer my thanks. And in terms of housekeeping, I very much would love for this conversation to be an engaging one. So please, if you have any questions, you can use a raise hand feature. Feel free to interrupt me. I'm going to be looking at the screen, making sure I'm not missing anyone. You can put a comment in the chat, but I would very much prefer that this is as interactive as possible because it's a small group. And so I look forward to learning together with you. And so thank you so much for your time, and thank you for inviting me to be here. So first, I want to make sure that you see my first slide. So Zoom's always a challenge. Can you see the first slide? I see
yes, we can see it, yes.
Okay, good. Okay, so why are we here? We're here today to talk about hypertension or high blood pressure. And it's one of my favorite things to talk about because I think it's critically important that women take care of themselves, but also take care of their hearts. And so hypertension, and we'll talk about it in the subsequent slides, is one of the leading risk factors for heart disease, for stroke, and other conditions. So again, thank you. All right, so in our time together today, I'm hoping that we'll first learn what hypertension or high blood pressure is. We'll talk about the burden of this condition in the US, but also talk about Black women specifically. We'll talk about what causes hypertension or high blood pressure. We'll talk about self-measured blood pressure monitoring, a term which shouldn't be new to anyone on this call. We'll talk about what you can do, right, to prevent and control hypertension. So let's first start off with establishing, the definition. What is high blood pressure or hypertension? So I'm going to be using those two terms interchangeably, but they mean the same thing. So blood pressure is the force, of blood against the walls of the artery. So this is something that you don't feel, right? So when the heart pumps blood, it exerts a certain force, right, against the walls of your arteries, and no one feels that, right? And blood pressure changes throughout the day. If you're exercising, your blood pressure goes up. If you're stressed, it goes up. If you drink caffeine, it affects your blood pressure. However, if your blood pressure stays elevated or high over time, this is what we call hypertension or high blood pressure. So one thing to note is that you can check your blood pressure now, and in 2 minutes, you may get a different number, and that's what your blood pressure does. But if it stays elevated over time, that's a problem. And blood pressure is given in two readings. So there are two numbers that we are concerned with, the top number and the bottom number. So the top number is what we call your systolic blood pressure, right? So this is the pressure in your arteries when your heart beats, right? So your heart beats and it relaxes, right? So when your heart beats, the top number is the systolic blood pressure. The bottom number is what we call your diastolic blood pressure. And it's the pressure in your arteries in between the beats, right? So when your doctor or your provider tells you your blood pressure, they usually provide you with those two numbers. So the first thing we want to talk about is symptoms of hypertension. So the first question I'll pose to you is, are there symptoms of hypertension? I'm hoping at this point someone will unmute and tell me, what do you know about the symptoms of hypertension? Are there symptoms? What are the symptoms?
Yes, there are.
Yes.
I heard some yeses.
Well, no, this is Sia. Generally, you don't have the symptoms.
Thank you. Thank you so much. Well, hypertension has no symptoms. Thank you. Right. So that's why we call it a silent killer. So what you see on your screen on the right is a cover of the Times magazine in 2004. And hypertension was described as a stealth killer. It was a stealth killer then, it still is, right? So it creeps up on you. So people may have hypertension for decades and not know it, because remember I said the blood pressure is the force against the arteries, right? The walls of your arteries, and no one feels that, right? Because that pressure is so minimal that the body does not feel that, oh, the pressure is going up or down, right? But it's still damaging. So hypertension has no symptoms. But that's the importance of knowing your blood pressure, having it checked, right? To know if it's high or if it's low. You cannot trust your body to tell you if your blood pressure is high or low. However, I have to stress that sometimes when your blood pressure is very severe, if you have severe hypertension and it's 180 over 120, that's when your body is going to try to tell you, no, you need to seek care. Something's not right, right? So when it's very severe, and so you may have severe headaches, you may have a nosebleed, but that's only when your blood pressure is that high, right? So any questions about the slide? No, okay. So why do we care about hypertension, right? So I think I alluded to this a few moments ago that hypertension is one of the leading risk factors, right, for heart disease, for stroke, for heart failure. So we used to call this congestive heart failure. Now we just call it heart failure, right? So that's when the heart is not working as effectively as it does as a pump. So we know the heart is a pump, right? And if your blood pressure stays elevated for a long time, it damages your heart and it's not able to beat as effectively, right? And it can also cause sexual dysfunction in men, but in women, it may also lower your libido. High blood pressure can also do some real damage to your kidneys, right? So in the early stages, you may have what we call chronic kidney disease, but if the problem is not addressed, it can lead to what we call end-stage renal disease. So at that point, your kidney is so severely damaged, right, that you either need a transplant, right, or may need dialysis, right, for a certain period of time. So these are all the complications we want to prevent. And that's why we talk about hypertension, and we want people to know their high blood pressure and control it, because these are all consequences that are costly, but are also deadly, but there's something we can do about it. Hypertension can also damage your vision. And we're also learning that hypertension is a risk factor for what we call vascular dementia. It's a special type of dementia. So for people who have high blood pressure over time, it's thought to cause a specific kind of dementia called vascular dementia. So the first step is to first know your blood pressure, but doing something about it will prevent these complications. So I don't want you to walk away with, oh, if you're diagnosed with high blood pressure, you're bound to get stroke, heart attack. No, you can take charge and you can keep your blood pressure lower or normal. And we'll talk about what normal means to prevent all of these complications. So what is normal blood pressure? Where should your blood pressure be? And I see there's a comment in the chat. I'll check it out. Yes. So thank you, Susan. High blood pressure is the main or leading risk factor for kidney failure. And that's why we see, particularly in the Black community, right? We have, some of you may have friends or family members who may have kidney disease, right? And often the underlying risk factor is hypertension. And that's why when I interact with people in the community, I stress the importance of prevention. We want to prevent that damage from happening in the first place, and controlling your blood pressure is the first step. So thank you so much, Susan. So blood pressure categories. So this is something I'm hoping all of you will remember, right? So how do you know if your blood pressure is normal? We talked about the top number and the bottom number. So we're going to use this green light, yellow light, orange, and very, dark red, light system to help you remember. If your blood pressure is less than 120, the top number is less than 120, and the bottom number is less than 80, your blood pressure is considered normal. But do note that your blood pressure changes as you age, right? So if 10 years ago, your blood pressure was normal, it's not a reason to relax, right? Keep living a healthy lifestyle to prevent your blood pressure from increasing to the higher categories. If your top number is 120 to 129, and your bottom number is still less than 80, we say you have elevated blood pressure. So you're trending in the direction of hypertension, but that can be reversed. If your top number is 130 to 139 and the bottom number is 80 to 89, you have what we call stage 1 hypertension, right? And this is, and in 2017, the American Heart Association redefined the classification of hypertension, right? We used to call it pre-hypertension. We don't use that term anymore, okay? So please do take note of that. But again, the point to stress is that if you end up in the elevated BP or stage 1 hypertension categories, you can reverse it, right? By lifestyle changes and medications. But if your top number is 140 to 159 and your bottom number is 80 to 99, you have what we call stage 2 hypertension. So this is a term that your provider may use. And some of you on the call may have been told that you have stage 2 hypertension. And so when your blood pressure gets to the 160 and 180 categories, that's where we get very concerned. And we don't want people walking around with blood pressures this high. If your blood pressure, your top number is greater than 180, right, and the bottom number is greater than 120, this is an emergency. This is not something that you just sit and relax. Oh, next week I'm going to see a doctor. This is an emergency and you need to act fast. If it's high because you stopped taking your blood pressure medicines, please resume taking your blood pressure medicines, but do note that these are the different categories for high blood pressure. Any questions? So, okay, so Tanya was asking what type of dementia is called vascular dementia. Okay, vascular dementia. Okay. And Tanya shared that her blood pressure has been high, and we can talk about, and Tanya, I see your hand raised. Do you want to make a comment?
No, I just wanted to say that, yeah, it has been that high for a long time while I was just on the amlodipine. But then the doctor added the losartan, and it seems to be doing better. But yeah, so I'm just very concerned about the potential for my blood pressure to often get that high. Yeah. It's not unusual for it to have been like 179 over 90 something, or like that, in that range. And so she had to work really hard with me to get it down just a little. So I haven't monitored it for a while. So I guess I need to start doing that.
Please. And you said it yourself, you need to monitor it. And one thing I want you to walk away with is that if your blood pressure, you're taking your medicines regularly and your blood pressure is still 160, 170, that's not normal, okay? With high blood pressure or hypertension, often you need more than one medication to bring your blood pressure down, right? And the medications have different effects on your blood pressure, right? So if for months you've been taking the same pill and your blood pressure is not improving, please reach out to your provider, right? And talk about the fact that, you know what, I've been taking my medicines as you prescribed and it's not working, right? My blood pressure is still high. Can we do something about it? And often they may increase the dose or add on a different type of blood pressure medicine, right? So we have beta blockers, those are a type of blood pressure medicine, right? We also have ACE inhibitors or diuretics. So your primary care provider will work with you to figure out which balance of medications will help bring your blood pressure down. Okay, so please, if you're taking medicines and you're not seeing an effect on your blood pressure, please speak out, right? And reach out to your provider and say, we need to do something about it. And you should feel empowered and they should listen to you, right? Sometimes clinicians don't listen. You have to make them listen to you and make changes, okay? And I see Celestine has her hand raised.
Good morning, doctor. I had the same question in the previous session, and they suggested that maybe you could answer it. Is my blood pressure, my systolic blood pressure averages, according to my cuff, 131 first thing in the morning, but my diastolic is 61. What does that indicate when you have a lower bottom number that falls in the normal range, but your top number is high?
That's a great question. When it comes to hypertension, both numbers matter, but we are usually more concerned with the top number. So a high systolic blood pressure is more associated with higher risk for heart disease than the bottom number. So in your case, your bottom number is normal, so you're in good shape. But the top number, right, is where clinicians focus a lot on lowering, because that's been shown to further increase your risk for heart disease. So remember we said the top number of the systolic is the force of your of the pressure in your heart or the blood vessels when your heart beats, right? But the diastolic is in between beats. So when the heart is beating, we don't want that pressure to be that high, right? So I hope that answers your question.
It does. Thank you so much.
Thank you. And Carolyn has her hand raised.
Actually, it's Karen.
Karen. Okay.
Yes,
Thank
I'm under the name of Carolyn. You mentioned that, and I don't know how to show my picture as I'm talking. I'm sorry, but
That's fine.
you mentioned that blood pressure over a period of time that's not treated could affect our kidneys.
Yes.
Isn't one of the side effects to some of the blood pressure medications also could affect our kidneys?
So most of the research that has been done has not shown that taking your medicines as prescribed is going to damage your kidneys, right? There are some people who may already have some extent of kidney damage, and so the clinicians may prescribe different medicines, right? Because they would be more sensitive to any other effects, right, on their kidney. So the kidney is responsible for clearing any toxic, material in your body, and especially from your diet or medicine. So if your kidney is damaged, your provider will take that into consideration. But the high blood pressure medicine itself, right, does not cause the damage, right? It's supposed to treat and prevent kidney damage. But there are different types of medicines that will be prescribed if someone already has kidney damage. Does that help, Karen? Great. Thank you. And so one thing I also want to briefly mention is that there's a term that's used that's called resistant hypertension. So that's when someone's hypertension has been, high blood pressure has, or blood pressure has been elevated for a while, and they're taking medicines and it's not working, right? But one of the things that we often ask is the person taking the medicine as prescribed, right? Because sometimes people don't feel comfortable being honest with their clinicians. They ask you, are you taking a medicines? And sometimes people don't want to be judged, and they say yes, but the blood pressure is not coming down. And so the provider may change the medicine or add, or increase the dose. And then if you're still not taking it, then your blood pressure is going to be elevated, and they may describe it as resistant hypertension. And often it's because the medication is not being taken as prescribed. That's one of the reasons. But sometimes there are some people who need a different combination of medicines that will help to improve their blood pressure. So one of the first steps in trying to diagnose resistant hypertension is understanding to what extent the patient is taking the medicine as prescribed. Okay. Okay, so Susan asked about, she said, I heard that blood pressure was expected to go up with age and the guidelines were different based on age. And when did that change and why? Are there societies in which elderly people have blood pressure rates recommended without medication? You bring that up a very important point. And that was one of the sources of contention in the 2017 guidelines, right? So there was a camp of people who felt like, well, for older adults, it's not appropriate to lower the target for what we describe as normal blood pressure, because older adults are more likely to have lower blood pressure. So if you increase the dosage of the medicines, they may be at risk for falls or complications, right? But we also know that Black people are more likely to have high blood pressure. So there's also a group that feels like we should still stick with the 2017 guidelines and consider less than 120, right, over 80 normal blood pressure, and consider blood pressure control as less than 130 for older adults, right, systolic, and less than 90 for older adults. But there's the American Academy, and I won't get into that, of family physicians that disagrees about what the target should be. But the most important point is work with your provider to figure out what works best for you, right? Everyone has a different health history, so you need to work with them to figure out, in your case, considering other risk factors, right? So hypertension is one of the risk factors, but if you have diabetes, if you have a history of heart disease in your family, all of that has to be taken into consideration and how your treatment plan, right, is created, right? So there isn't a one size fits all. There are guidelines, but it's important to consider your unique context. Okay, so I think we've alluded to this. There are a number of risk factors for hypertension. So family history is one of them. So some of you may have parents or siblings that have hypertension. It tends to run in families, but again, doesn't mean there isn't something you can do about it, right? So as you age, your blood pressure tends to increase, right? So diabetes is a risk factor, being physically inactive, poor diet, overweight or obesity. A lot of women I've interacted with have been surprised when I've mentioned that. So being overweight or obese actually increases your chance of developing hypertension. And that's because the more of you there is, the harder your heart has to work. And that's how I often explain it, right? So lowering your body weight or getting more active, right, is one of the ways that you can bring your blood pressure down. So drinking too much alcohol. So for women, that would be 1 drink a day, right? If you drink more than 1 drink, a standard drink a day, that increases your chance of developing hypertension. Sleep apnea is also a risk factor for hypertension. And stress, I think we are more and more appreciating the fact that if you continue to work in a high stress environment, you live in a stressful environment, over time, absolutely, that will increase your blood pressure. So what is the burden of hypertension in the US? So unfortunately, in the US, almost half of the population is thought to have hypertension. And we'll talk about the burden in men and then women. So in men, about 52% of men have hypertension, but we know that Black men have the highest rates of hypertension in the US and in the world to some extent, right? And white males have a lower prevalence of hypertension compared to Black males. But in women, we know that 43% of the population has hypertension. But again, look at the numbers for Black females. Almost 58% of Black women in the US have hypertension. And this is concerning. And this is why we need to do something about it, because we want women to live longer, healthier lives. So what about blood pressure control rate? So among people who have been told they have hypertension, we want to bring blood pressure down and make sure that it's controlled. And so if we describe or define control as less than 140/90, right? In 2013, only 54% of people had their blood pressure controlled. But that worsened in 2017 and 2019, where only 48% of the population was said to have controlled blood pressure. So this is using a higher cutoff of 140/90. So what about when we use a cutoff of 130/80? Well, it paints a pretty startling picture, right? So in 2013 to 2014, only 25% of people, US adults, were said to have controlled blood pressure. But in 2017 to 2019, only 19% of people had their blood pressure controlled. And this is why hypertension or uncontrolled hypertension is considered a public health crisis, right? So COVID-19 is on everyone's minds, but high blood pressure is something we should all be talking about and doing something about. So only 1 in 5 adults have their blood pressure controlled to less than 130/80. So when we talk about these disparities, I shared earlier that about 58% of Black women have hypertension. I talked about the fact that blood pressure control rates are poor, but the question we should ask ourselves is that why, right? And one thing I want you to walk away with, it's not just one thing. We can't blame patients for having uncontrolled blood pressure, right? There are different factors that contribute to poor blood pressure control rates. Our society, right, does not provide the necessary support for people to live long, healthier lives. There are people who live in food deserts, right, and neighborhoods that they don't have access to healthy foods, right? And so they're not to blame for that structure. there aren't adequate community resources, right? Within the healthcare system, there are issues that need to be addressed, right? There are staffing issues, teams don't function well, health systems are not reaching out to the community. And at the clinician or staff level, clinicians are not perfect. Sometimes when someone's blood pressure stays elevated over time, clinicians do not act to either make changes to their medicines to understand, are they being adherent? They are not actually intensifying treatment when it's needed, right? So that's also why blood pressure control rates are poor. They may also not have the right communication skills in terms of interacting with patients from different backgrounds. And so that's why we emphasize training, right? Cultural competency, cultural humility, right? Knowing how to interact with people in a respectful way, right? That allows them to be honest about their unique challenges. And at the patient level, we know that sometimes people have low health literacy. They may have unhealthy lifestyles, but these unhealthy lifestyles are a result of the environments that they find themselves in, right? And their medication taking habits. So I want you to walk away with the fact that, yes, there are things that you can do, but there are things that the society overall can do to help people live longer, healthier lives, right? We need to change the structures in our neighborhoods and our communities that allow people to exercise safely, to eat healthier, right? So we all need to do our parts. So we're actually going to take a pause here and do a quick knowledge check, right? We need to keep this interesting. What's in the number? So I mentioned that a blood pressure of less than 120/80 is considered normal, right? So you just took your blood pressure and it's 135/85. Is that considered a hypertensive crisis that needs emergency treatment? Yes
No.
or no?
No.
No, yes. You love it. So what number would you consider a hypertensive crisis, if you remember?
180/120.
Oh, yes, I love it. Thank you. Thank you so much. Yes, so it seems like everyone's paying attention and we got it. That's lovely. Okay, so I think I alluded to this point earlier that, you know, social determinants, the conditions in which we live, play, learn, work, they all affect our health. And over the past couple of years, there's been a greater appreciation for the roles that social determinants play in promoting health, right? So my colleagues and I, we performed an analysis of national data on about 21,000 US adults, right? And 51% of them were women. And we found that indeed, no surprise here, that social determinants were associated with hypertension prevalence and the likelihood of having controlled blood pressure. We found that non-Hispanic Black people were less likely to have their blood pressure controlled. I think I made that point earlier. But when we think about racial disparities, it's not because of what skin color, but it's because of these underlying, right, differences in social determinants. So every time we talk about disparities, we are learning to talk about it in a better way and not just say Black people have a higher prevalence of hypertension or they're less likely to have their blood pressure controlled. But we also want to talk about why that is the case. And some of the reasons are that Black people and racial and ethnic minorities are less likely to have a routine place for healthcare. They're less likely to have health insurance, right? So how's someone supposed to get medicines on a frequent basis if they don't have health insurance? There are over 30 million Americans who do not have health insurance, and that is unjust, right? And people who were employed versus unemployed, especially women, were more likely to have controlled blood pressure, right? And this finding, the last finding was quite interesting. Being married, right, versus unmarried was associated with a higher odds with actually a lower odds of controlled blood pressure. So we were trying to figure out what to make of this result. It's possible that, you know, we know that women wear a lot of hats, right? Where we're taking care of families, you're taking care of children, and we're taking care of partners, right? So one of the things we thought was that maybe women who are married, right, and have a lot of responsibilities, may be less likely to prioritize getting their blood pressure controlled, right? There's no way we can know if that's for sure, right? But it's one of the things that we considered that, you know, we, especially Black women, do a lot, right? We do a lot for our churches, for our communities, and those type of women may also not have the time, right, to take care of themselves, and that shouldn't be the case, right? You need to bring yourself, put yourself first in many ways when it comes to your health, right? And so, yeah, I wanted to share that. The takeaway point here is that, and I'm not trying to say no one should get married, or if you're married, leave your partner. No, that's not the message. That's not the message. And I don't want anyone quoting me as, well, Dr. Commodore said, if you're married, you're less likely to have your blood pressure controlled, right? No. I see Marlene said, yeah, I'm not going to comment on that, but yeah, let's keep it real. But, if you're married and you have kids, you're taking care of your parents, that's no excuse, right? Because they need you, right? If you end up with a heart attack, stroke, who's going to be there for them? So put your heart first, okay? All right, so let's delve a little deeper into women, hypertension disparities in women, right? So a team has already analyzed data from what we call NHANES, the National Health and Nutrition Examination Survey, and they found that between 1999 to 2002, 2007 to 2010, and 2015 to 2018, there were large increases in hypertension awareness, treatment, and control, about 10%, right? And that shows that overall the population is doing better, except for Black women, right? So Black women were less likely to experience these increases in hypertension awareness, treatment, and control, right? And that's why, I'm so glad that this organization has put together, this project to help Black women take better care of their hearts and improve their blood pressure, right? So all women should be aware that hypertension is a leading risk factor for heart disease, stroke, etc., right? But we also know that when women have hypertension in pregnancy, that is also a risk factor for having hypertension postpartum, right? So that's something to note. If you have loved ones who have been diagnosed with hypertension during pregnancy, they should be making changes, right, to prevent hypertension after they deliver, right? Hypertension in pregnancy, either before pregnancy or less than 20 weeks during pregnancy, the prevalence of chronic hypertension in pregnancy actually increased 13-fold. So between 1970 and 2010, we've seen a very drastic increase in chronic hypertension during pregnancy. And Black women, again, had a 2-fold higher rate compared to white women, okay? So again, this stresses the importance of making sure that we are working with Black women to support them so that they can prevent heart disease. So why focus on hypertension in women? Because every minute in the US, a woman dies of a heart attack, stroke, or another form of heart disease. We also know that 9 out of 10 women have at least one risk factor. We also know that heart disease and stroke cause more than 1 in 3 pregnancy-related deaths from 2011 to 2015. We also know that uncontrolled hypertension can harm the mother as well as the baby, right? So we want to control blood pressure during pregnancy, after pregnancy, and also before pregnancy. And that's why it's important for women to be healthy even before becoming pregnant, right? So there are a lot of initiatives now that are focused on young women, right, to improve their heart health prior to pregnancy. And we know that although women older than 55 have a higher risk of high blood pressure, recent studies have shown that among Black women, younger Black women too, we're seeing a higher risk of high blood pressure. And that's why this is an urgent issue. And thank you. Marlene shared that her daughter was 5 weeks premature because she had high blood pressure during pregnancy. She was hospitalized for her high blood pressure. Yeah, and thank you for sharing that. So that stresses the importance of educating Black women, young Black women, whether it's through sororities, and some of you may be in a sorority, in terms of educating young Black women in college that this is the time to set yourself up to do well, when you become pregnant in the future. All right, thank you. And she said she had no symptoms, right? So again, stressing hypertension is a stealth killer. It's a silent killer. yeah, and that's why we need to pay attention to that. So the American Heart Association has what we call Life Simple 7. So high blood pressure is one of the risk factors I mentioned, but in order to lower your risk for heart disease, you should not be smoking. If you are currently a smoker, there are resources that are available to help you to quit. You should be active, right? Physical activity, and we'll talk about it in more detail, lowers your risk for heart disease. Having a normal weight, right, also prevents heart disease. If you are overweight or obese, is a risk factor for heart disease, stroke, and other conditions. Having a healthy diet, having normal blood glucose, having a normal cholesterol, so having high HDL, right, having low HDL, those are all together what we call Life Simple 7. And having a normal blood pressure is one of the components of the Life Simple 7. So we've talked a lot about, the burden of hypertension. One thing we're gonna start talking about treatment and what you can do, right? I think one thing I want you to walk away with is that you have the ability to improve your blood pressure, right? You have the resources through this organization in terms of managing your blood pressure. So there are lifestyle changes, right? And there are several studies that have shown that lifestyle changes are as effective as blood pressure medicines, right, in improving blood pressure, right? So healthy diet, physical activity, there are medications. And I stressed this earlier. If you're prescribed medicines and you're experiencing side effects, please speak to your clinician. Please feel comfortable saying, well, since I started taking this medicine, I've been experiencing XYZ. So can we do something? Can we change the medicines? Can we lower the dose? Can we do something about it? But please do not discontinue your medicines because of side effects, right? Because there are different options out there, right? Your clinician has a range of blood pressure medicines to choose from that will work for you. So side effects should not be a reason for discontinuing your medicines. Okay, so we talked about weight loss in the previous slide. So one thing that most people are surprised to hear is that for every 1 kilogram, so 1 kilogram is 2.2 pounds that you lose, if you're overweight or obese, if you lose 2.2 pounds, you can bring your blood pressure down by 1 millimeter of mercury. So imagine if you were to lose 5 pounds or 10 pounds, that could bring your blood pressure down, right? If you were to change your diet, we have what we call the DASH diet. So it stands for Dietary Approaches to Stop Hypertension. It's a long word, but we call it the DASH diet, right? So this consists of a diet that is high in fruits and vegetables, it's low in saturated fats. If you were to adhere to what we call the DASH diet, you can bring your systolic blood pressure down by 11 millimeters of mercury. That's the effect that medicines could have on your blood pressure. So imagine this. If you were to take your medicines as prescribed and you change your diet and you lost 5 pounds, right? And you reduced your sodium intake, right? And also increased your intake of dietary potassium, that would have a greater impact, right, on your blood pressure than taking medicines alone, right? So when we talk about blood pressure control, in some people, medicines are prescribed, but the lifestyle should come with it, right? So don't think that, okay, I'm taking blood pressure medicine, so I don't have to worry about my lifestyle. No. If you were to make some of these changes, right, and you can set realistic goals, right? You can say that, well, I'm going to start with lowering my intake of sodium. So the optimal goal is less than 1,500 milligrams per day. And how do you know this? Read food labels, right? It's hard to estimate how much sodium is in the foods we eat, but if you're purchasing something, please make note of the food labels. See if one serving of whatever you're buying has 1,500 milligrams of sodium in there, you should be concerned, right? So please take time to read your food labels and know what you're putting into your body, right? And there are a number of resources out there that can help you to understand how to read food labels effectively. But the takeaway point for this slide is lifestyle interventions work, right? They work in many cases just as well as blood pressure medicines. And in some people, if you're in the elevated blood pressure range or stage 1 hypertension range, your clinician may say, you know what, let's start with lifestyle. Let's see if you can make these changes and you can lower your blood pressure, you may not ever need to be prescribed medicines. Yes, but often people struggle with making those lifestyle changes and move up to the higher categories. But if you're able to take these steps, if for instance, your blood pressure was normal and you saw a provider and they said, well, your top number is like 128 or 130, 135, right? So we need to do something about it. Usually lifestyle modification and taking into account what other risk factors you have. So if you don't have any other risk factors, you don't really have a family history of a heart attack or stroke, they may start with lifestyle, right? And consider the addition of medications in the future. Okay, so physical activity, exercise is medicine. Please make note of that. Exercise is medicine, right? And when we think exercise, often we think, well, I don't want to go to the gym. Well, neither do I. So I don't go to the gym. I play ping pong instead. You need to find something that works for you. If you love to dance, which I do, find opportunities to get together with your friends, right? And I know things are a little more complicated now because of the surge in COVID-19 cases, but there are ways to do that safely. So find what works for you, right? So aerobic activity can lower your systolic blood pressure by about 5 or 8 points, right? And if you do this consistently, that will have a greater effect on your blood pressure. And sometimes, people feel like, well, if the recommendation is 90 to 150 minutes and I only do 30 minutes, that's bad. That's better than nothing. One thing we are acknowledging now is some physical activity is better than nothing, right? So even if it means going up and down the flight of stairs 10 times a day, if that's all you're doing, that's good for your heart, right? It's better than sitting down all day. And if you love watching shows, maybe try watching the show standing, right? March on the spot, right? Don't sit for hours on end, right? So the key is to move more, right? Move more and sit less, right? So I think there's several ways you can park further away if you're going shopping, right? Don't try to find the closest spot to the entrance. You can park further away and get more steps in. We're supposed to walk, 10,000 steps a day, 10,000. Do you want to guess how many steps the average American gets a day? 10,000 steps is about 5 miles. Any guess? How many steps a day do you think the average American takes?
500 to 1,000.
It's about 2,000. Yeah, not impressive at all. And during the COVID-19 pandemic too, you can imagine, right? That has declined drastically, right? And because people, are afraid to be out there to contract COVID, so physical activity across the board has declined, right? And alcohol, I alluded to this earlier. If you do drink, please lower your intake of alcohol. Okay, so we'll go through, I know we have about 10 minutes and please keep the questions coming, right? But I want to go through a couple of myths, right, about hypertension. So let's start with this, myths and facts, right? So the first is hypertension can't be prevented. Is this a myth or is it a fact? Someone
Myth.
says,
Myth.
I heard a myth. Who said that? And why do you think that's a myth?
Well, this is Sia. I think it's a myth because there are things that you just reviewed that we could do. We could do the exercise. We could change our diets. We could reduce the sodium intake. They're just.
Yes. Thank you, Sia. You're absolutely right. It can be prevented. The lifestyle changes. Sorry, someone was saying.
Yeah, this is Carolyn.
Yeah.
So that's a really tricky one for me because when you talked about earlier in regards to genetics and resistance to hypertension.
Mhm.
And I don't like to buy into the genetics. I think you can overcome that. However, the doctors don't tell you that. A lot of doctors don't tell you that. And so, but I'll be curious to hear from the doctor next month about the whole thing about the resistance and hypertension.
Right. Yeah. And thank you for bringing that up. I think you stressed the point I made earlier that in some cases you may have a family history But again, it does not mean that you will ultimately, right, develop it if you make certain lifestyle changes, right? And so high blood pressure is preventable,
Okay.
right? But in some cases, some people have a family history of it, and they make lifestyle changes very early on, and they may not develop it, right? So I think one thing I don't want anyone to walk away with is, if my parents had it, well, then I'm bound to have it. So that's it. No, that's not the case.
Okay.
I have a question. This is
Yeah.
Karen. So hypertension can be prevented but not cured?
Exactly. There is no,
That's
yeah,
tricky for me too.
it's tricky. Yeah, it's tricky. So hypertension is considered a condition that's not cured. But let me put it this way. So if you say, let's say your blood pressure is like 130, 40, you're on blood pressure medicines, and on medicines, it's 120, 119. It's good, right? But your blood pressure is good because you're taking medicines. If you've made lifestyle changes, right, and your blood pressure lowers to 110, right, over 70, it's lower because of the lifestyle changes you've made. If you take that away, right, your blood pressure will go up, right? And so it's not a condition that can be cured, but it can be prevented and it can be controlled, right? So thank you. I'm so glad you asked that. Okay. Right, and so someone asked about if blood pressure is brought under control, can you get off meds? So yes, in some cases, people's medicines are changed in terms of they either lower the dose, they may take a medicine away, right? So if you were on 3 medicines, for instance, and you've made lifestyle changes, you may go from taking 3 a day to 1 a day, right? So your clinician may make changes based on what your numbers are, right, over time, right? Great. So here's another one. No symptoms equals no problems. Is this a myth or a fact? This one should be easy. So if you don't have any symptoms, does that mean you have no problems?
It's a myth.
It's a myth, yes, right? So we
It's a
talk
myth.
about the fact that if you're feeling fine, hypertension is a silent killer, so you should know your numbers, right? So table salt is the only source of sodium. Is this a myth or a fact?
Myth.
Thank you, right? So different, so chicken, yeah, people are surprised when I say chicken. Yes, chicken is a source of sodium, right? Because they use sodium to preserve the chicken, right? So when you cook and you throw a lot of sodium in there, so canned foods, so please read the labels. You can actually rinse if you buy canned vegetables. You can actually strain, right, the liquid that it comes in and rinse it to reduce or remove the sodium from it, right? You're not going to get it to 0, and that's why it's preferred that you buy frozen vegetables than canned vegetables, because sodium is what's used to preserve it. Okay, so again, I think I've made this point earlier, working with your clinician, you can figure out the right combination of lifestyle changes and medicines to improve your blood pressure. So other ways you can take control of your blood pressure is checking your blood pressure. And I'm so excited that this program actually provides you with home blood pressure monitors, and actually brought a prop here. Yes. And I hear you actually have the Armon 10 series, which is like a really good blood pressure monitor. But this is one of the ways that you can take control of your condition, right? So it's important to set a goal for yourself. I love this picture. Every time I present it, it makes me smile because, like I said, do things that bring you joy, right? We know that life can be very stressful, but find a network of sisters, of people that you connect well with, right, to help you to achieve your goals. If it's exercise, find other people who want to set that goal too, and say, can you help me? Like, even if it's 2 days a week, right, it's better than nothing. But really try to tap into your social network to improve your lifestyle. And then medicines. So I think almost half of Americans who are treated for hypertension don't actually take their medicines as prescribed. I've made this point earlier. Please take your medicines as prescribed. And if there's a reason why you can't, please talk to your clinician. There are pill boxes you can use to help you remember to take your medicine. You can develop a routine. It's something you can do maybe right after you brush your teeth, right? You can associate it with something you do every day. If you do your devotion, right? You can say every morning after my devotion, I'm going to take my pill. And after a while, it becomes a habit. Okay, so quick knowledge check, and I know you're running out of time, but your friend Sandra's grandmother just had a stroke. She tells you the doctor said her grandmother has high blood pressure. She doesn't know anything about hypertension. What should you tell her? A, B, C, or D? Now I'll let you read the options and tell me what you should tell her about hypertension. Is it A, B, C, or D? I see Karen with her hand raised. Which one do you think it is?
A.
Thank you. Bingo.
Mhm.
I
Okay, so
signed it, A.
you got it. So home blood pressure monitoring. I want to, in our time together, I want to quickly cover, and this is also one of the critical components of this program, right? You need to measure your blood pressure at home. You have to check your blood pressure several times a day, ideally before you take your medicine. So you check it twice and you keep record of it. But I've learned that in this program, you're also going to be using an app to help you keep record of your blood pressure. And you should also share the readings with your clinician so that they can use those readings to make any changes in your therapy, okay? So I hope this works out. I want to play a quick video here. And let me know if can you hear it?
Mhm. Yeah.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
Okay, what did we learn? Sorry, get it? What was the second one? Slip it, cuff it, and the last one is what? Check it. So I hope you walk away with that acronym. Get it, slip it, cuff it, check it, right? So this was created just a few months ago by the AHA, and I love sharing it. It's really catchy. You can't hear it and not want to dance, right? So get it, slip it, cuff it, check it, right? Yeah, so thank you. So blood pressure devices, important in our short time left. I want to mention that not all blood pressure devices are created equal. Great that you're getting blood pressure cuffs from this program, but there's a resource called validatebp.org that has a list of all validated blood pressure devices, right? So if you don't select the right blood pressure device, it's not going to give you an accurate reading. So if you have a family member who's trying to, looking for the right blood pressure cuff to buy, advise them to go to this website. And if that device is not listed on this website, they should not buy it. They'll be wasting their money because it's not considered a validated blood pressure cuff, okay? And now the wrist cuffs on that website, they just added some wrist cuffs, about 4 of them developed by Armron that could be used, but really the upper arm cuff is the preferred method. For some people, the cuff size may be too small, and that's when they could use a wrist cuff, but the upper arm cuff is still the preferred way to measure blood pressure, okay? And I was going to show this video. We are out of time, but really it's on YouTube. It's from Release the Pressure. It's a self-measured blood pressure monitoring training video that teaches you how to actually measure your blood pressure. It's a link that I can share with Cheryl that you can watch in your free time, but it actually walks you through how to measure your blood pressure accurately.
I think this video is included in the guide.
Okay.
So yeah.
So you don't. Yeah. So I went. That's
really
awesome.
Good.
Thank you.
Show it, yeah.
And you have a copy of the slide. So here are some steps that you need to follow to measure your blood pressure accurately. I wouldn't spend too much time on it. And I want to be respectful of everyone's time. I know it's 12:01, so I'll skip to the last slide, take home messages. So we know that the prevalence of hypertension is higher in Black women than white women. The burden of hypertension overall is high, but there's something we can do about it. There are a number of things we can do. Blood pressure rates control rates are declining, and that's why we really need to ramp up our efforts, especially within the community and through programs such as this one, right, to improve blood pressure control. And we also know that social determinants are the underlying causes of these disparities that we've seen or we continue to see in blood pressure outcomes. But lifestyle changes and adherence to prescribed medicines are effective approaches, right, to improve your blood pressure, and home blood pressure monitoring. And that's exactly what this program is going to help you to do, right? It will help you to take charge, take control of your blood pressure. And the last slide has some resources. I want you to consider taking the pledge. So there's Release the Pressure. It's a special initiative to improve blood pressure in Black women, right? So if you go to their website, you can click Take the Pledge. And today you can take the pledge to put your heart first and improve your heart health. And so with that, I'd like to say thank you for your time and attention.
Thank you so much. We thank you so much. This has been fantastic. And I told you all we were just gonna love, love, love her. So thank you for presenting this morning and entertaining all of our questions, giving us things to think about, things that we can take back to our next doctor's appointments. Just such a rich discussion this morning and presentation. So on behalf of all of us here, thank you so much. We are really, truly ready to start on this 6-month journey. So with that, Janine, do you have any comments, any closing comments you'd like?
Absolutely not. I think Dr. Commodore Mensah wrapped it up, and we thank Dr. Mulu as well for providing, her insights, experience, and research. And I think we're all off to a great start together. I see your smiles, your nodding heads, and thumbs up. Right, we can give each other thumbs up because this is a support team as well. So
yeah,
thank you.
So beginning on Monday, you need the monitors, right? So you're going to get information on how to get the monitors, where we're going to be distributing them, the safety precautions that will be put in place, and what you need to do in order to get your monitor. I know that there are a few people who are outside of the region. We're going to talk about how to get you a monitor, or see if your monitor that you have is already validated. It's on the list. So I'm really excited. So thank you so much, everyone. And until we meet again.
Thank you. Thank you so much for having me, and do take care. Right.
Thank you. Bye-bye.
Bye.
Thank you.
Thank you. Looking forward to the next meeting.
That is awesome. Looking forward to seeing you.